know that, again, the huge majority of people that are going to these online clinics are receiving diagnoses and then getting treatment. Now, some of them will have ADHD, but many of them don't. They're taking shortcuts, and I'll show you what is involved in an accurate assessment. But in many countries, and your country is one of them, there is a huge under-diagnosis and under-recognition of ADHD. I showed at the conference yesterday the rates of prescription for medication for ADHD. In westernized European countries, it's around 3 to 4% of children are being diagnosed and treated with ADHD. In India, it was less than 0.03%. That's a huge difference. And when we think that 5% of children in India will have ADHD, it means that really very, very, very few are getting access to what we know is the most effective treatment. So we have this big problem just now. And looking forward, actually we need to look back. In order to look forward to how we should be assessing ADHD, we need to go back to the old gold standard assessments. And there are now many evidence-based guidelines for ADHD around the world. We've reviewed them recently. And what's amazing is how much they agree with each other. All of those guidelines say that assessments for ADHD should be conducted by trained professionals, not just professionals with a qualification, but professionals that have a training in assessing for ADHD and related difficulties. And these include psychiatrists, psychologists, pediatricians. There's some agreement, and this is a growing discussion. I actually support this, but only support it with good quality training. Some agreement that general practitioners, those in primary care, can also, or should also, if trained, be able to assess and initiate treatment for ADHD. The real key is that an assessment needs to include a detailed clinical interview. And that clinical interview takes time. We reckon at least 2 hours for a good quality ADHD assessment. Now that doesn't have to be done all in one, and that can be challenging to find that time. But if we're not going to make mistakes, we need to work out ways to do it. There's also agreement, and I feel very strongly about this, that questionnaires are not adequate to make a diagnosis of ADHD. They may be helpful to gather information, to understand what different people are saying, but on their own they're not enough. And also, I have a lot of friends who are neuropsychologists. I've done a lot of work in neuropsychology of ADHD myself, but a cognitive assessment does not diagnose ADHD. It needs that clinical interview. And so the last point is, actually we shouldn't talk about ADHD assessments. We should talk about a comprehensive assessment for someone's broader needs and difficulties. Often that's about mental health needs, but it can also be about physical health needs. And so I try very hard, I often fail, not to talk about doing an ADHD assessment, but assessing someone for ADHD as part of their broader difficulties. I just want to talk a little bit about treatment. This is my motto. ADHD, easy to treat. You can write a prescription. Hard to treat well. Just writing that prescription is not going to make someone better. When we're treating ADHD, what are we doing? We're doing a whole hierarchy of things. We have to improve people's understanding. Psychoeducation is the bedrock of all ADHD treatment. We need to look at those core ADHD symptoms, but also the associated symptoms that go with them. We need to reduce and manage coexisting conditions and disorders. And our ultimate aim is not just to treat the symptoms, but to improve people's lives. I actually structure these in this order, not because I think improving someone's life is the least important thing, it's the most important thing. But to get there, actually treating the core symptoms, treating the other conditions, brings us to that point. And we've talked and we've heard from all three speakers and from Dr. Krishnamurthy about the importance of holistic care. For ADHD, we're quite lucky. We have some very, very efficient treatments for those core ADHD symptoms. They're medications, and actually medication is the only high-class, high-quality treatment we have for the core symptoms. But look at the rest of the circle, look at the rest of the interventions. We have dietary interventions on their own. They're usually not enough to fully manage the ADHD, but alongside the medications, they can really be helpful. We have what we call behavioral and psychological interventions. They're actually not very good at reducing the core symptoms, but they are very good at improving people's lives. And then a range of other things like the computer-based cognitive training, which doesn't help symptoms, but can help with the way that your brain's working. And so we need to put this together in a package. And actually, I won't dwell on this side, but the highlighted bit, our Australian guidelines are very clear in saying that treatment for ADHD should be multimodal. And that includes offering people medication for their core symptoms, but also offering them non-medication treatments to help manage the fallout, minimize the impact from those symptoms. And lastly, I just want to say why I think this is so important. ADHD is not just about naughty boys in school. In fact, ADHD impacts on women and girls almost as often as it does on boys. We used to think it was mostly about boys. We know that's not true. ADHD significantly increases offending. It significantly increases incarceration in prison. That not only harms lives both for the victims of crime, as well as the perpetrators and their families, but also it hits us in the pocket. It's very expensive. I learned recently to keep one adult male in prison in Victoria in Australia costs as much as having them in the presidential suite of the Crown Hotel in Melbourne with full service. I didn't realise that, but it's a big impact. Increases the risk of substance use, increases your risk of dying, both by suicide and by accidents. And on top of that, we have the poor academic performance and the huge costs, both personal and financial. But our medications actually improve all of these. By giving medication to people with ADHD, we reduce offending, we reduce substance use, we reduce premature death, both by reducing suicide and reducing death by accidents. And we reduce physical and emotional, and actually recently we've just realized sexual abuse of children with ADHD. Huge, important things. So for me, my summary is accurate assessment is the key. Get it wrong, the wrong people will be offered treatment, and the right ones will miss out. Good quality assessment is not difficult, but it does take time. It requires training and it requires support. Psychoeducation is the key, the foundation for all other treatments. And good psychoeducation means you know what you're talking about. You don't just parrot the myth of ADHD. And then multimodal treatment that combines a medication and non-medication approach delivers the best outcomes. Thank you.